Hello, I am Dr Debojyoti Sarkar. I am a surgeon. I practice in Delhi and Gurgaon. One of the most common presenting symptoms of patients in my outpatient department is bleeding from the rectum during passing stool. It is not a very it's not a very usual thing to happen after a certain age. It is something which needs attention and it is never to be neglected. So any person, whether a male or female, is having bleeding from the rectum, they should immediately consult a surgeon and get the problem addressed. One of the most common causes of bleeding from the rectum is hemorrhoids or piles. They are often painless. Hemorrhoids can be painful only in case they are getting thrombosed, or it's called acute piles, which is very painful. At that time we avoid surgery. Surgery is not the only option in treating the hemorrhoids, but yes, the hemorrhoids must be treated and the bleeding must stop and it should be cured. One of the most common thing which the patients come and discuss is that they are having pain associated with bleeding. If they have pain, it is very unlikely that he or she might be having hemorrhoids. Hemorrhoids are painless, severe bleeding pathology in the rectum, and patient loses lot of blood, so much that they can have implications on their health and the hemoglobin goes down. Hemorrhoids are broadly classified into 4 categories. Depending on the category, the treatment also varies. Yes, there are medical treatments also. There are certain medicines which can stop the bleeding, which can shrink the hemorrhoids to a little bit. There are some ointments, there are injections which can be given inside the hemorrhoids. These all treatments are completely dependent on the grade of the hemorrhoid and it is to be discussed with the surgeon. And any grade hemorrhoid or any amount of bleeding should not be treated by any other over-the-counter medication or some medication which might have been prescribed to a patient's known person or a relative. Hemorrhoid is a subjective matter. Bleeding, its condition and the grade of the hemorrhoid has to be judged by the surgeon and the treatment modalities to be offered. Hemorrhoids surgery, there are a few types of surgery. First is the conventional surgery, where we remove the hemorrhoidal tissues and the masses. It is very good if they are very severe prolapsed hemorrhoids, patients with paralysis, patients with incontinence of stool who cannot hold their stool because of spinal cord injury or some paralysis or some brain hemorrhage where the reflexes and the sphincter muscle is gone. Open surgery is for very prolapsed and ulcerated hemorrhoids. It can be done in other hemorrhoids also. The advantage is that it removes the hemorrhoidal mass. Yes, after the operation there is a wound and that wound heals in about a week's time if you take sitz bath in warm water. The other method is the stapled hemorrhoidectomy. It's called the stapled hemorrhoidopexy where the hemorrhoidal masses are not removed. The blood supply which is coming to the hemorrhoidal masses, that is cut off and a new anastomosis is done wherein the hemorrhoidal masses are pulled inside and eventually they shrink and disappear. There is a laser form of surgery also. There are all these devices and all these surgeries are directed towards one thing, is to stop the bleeding forever. Why surgery is essential? First, a clinical examination by a surgeon is very essential. it is because that whether hemorrhoid is the only source of bleeding or there is any other source which needs immediate attention. In my clinical practice in elderly patients, I always do a colonoscopy to rule out any other pathology which might be causing the bleed, and many times there are many pathologies in the colon. There can be a mass, there can be some cancer, there can be angiodysplasia, there can be other conditions which can bleed. There can be polyps, there can be other diseases which can bleed, but it is always better to rule out any other diseases in the colon before going for conventional or any other form of hemorrhoid surgery.